Everybody, thanks for having us. My name is Elizabeth, and I'm one of the addiction and mental health counselors from Addiction Services of Thames Valley. Jenna, I don't know if you're recording yet. If you wanted to start recording, you can.
And my name is Tanya, and I'm also an addiction mental health counselor with Addiction Services of Thames Valley, and I work in the Oxford County area.
I don't know why I can't flip the screen. There we go. Okay. So today we're going to be talking about addiction, substance use, and wellness. So starting off with a little bit about what addiction is. So addiction is an uncontrollable impulse to repeat a behavior regardless of its consequences. So this often refers to the need for some of a psychological dependency, when an individual feels like they really need a substance to function or really feel comfortable with themselves or in their skin. Sometimes, but not necessarily, an addiction includes a physical dependency. So this is when a person's body has actually adapted to the presence of a substance. And so when the substance isn't there, they will have withdrawal symptoms. And the other piece of a physical dependency is that over time they have a tolerance to that substance. So then they need more and more of that substance to get the same feeling or effect out of the substance. So addiction really does come down to the presence of 4 C's. There is a craving for the substance, a loss of control over the amount or the frequency of their use. There's a compulsion to use, and then they're using despite consequences in their life, whether it be consequences at work, at home, but something has become problematic in their life in some way. So when we talk about addiction, we often talk about it through the metaphor of an iceberg. So when you look at an iceberg, the top part above the water you see is really only makes up about 15% of that full iceberg. And so that's what addiction is. Addiction is the behaviors that you see above the water. It's the problematic behaviors in their life. It's the substance that are there used, the gambling problems, the problematic internet use or technology use, whatever the behaviors are, that's what the addiction is. But really what you need to start to understand is that, as with an iceberg, 85% of that iceberg is under the water. And so what is behind an addiction is what needs to be worked on. So looking at things like loneliness or grief or trauma. And so that's really where you need to focus on a lot of the treatment, is working on those underlying factors that contributes to the use happening in the first place. And so substance use happens on a continuum. Everybody starts with non-use. No matter who you are, at some point you're going to have no substance use in your past. And over time and through substance use, what happens is people may start to experiment, try different substances to occasional use, and you move through potentially to regular use. Once substances become really problematic, you're moving into the problem use and the abuse. And then once you've developed some of those dependencies, that physical or that psychological dependency, you move to the full end of the spectrum. So we look at substance use as this continuum, and as you move from the left to the right, usually people are using more, or they're gambling more, their behaviors are becoming more off. The thoughts of using become more as you move across the spectrum. And the more you move, the more life areas become affected. So you start to use more than one type of substance, more than one type of problematic behavior, the farther you move to the right on the continuum. So kind of looking at what are some of the different substances that are out there. We do classify them in different areas. Great is depressants. So this is where you're going to find substances like alcohol or benzodiazepines or opiates, other specific drugs like GHB or Rohypnol, barbiturates, and inhalants like glue or different gases that people might inhale. On the other side of the spectrum, you have the stimulants. So this is where you get substances like cocaine or crack, amphetamines or methamphetamines like crystal meth. This is where Ritalin comes in, and things like caffeine can be under the stimulant category too. Other categories can include substances like GHB or Special K, things that might have different properties depending on the person or depending on when they're using. We typically classify cannabis as its own category because, again, depending on the strain, depending on the type, depending on the person, you can have different effects for other, and it can also have hallucinogenic effects too. So it kind of gets its own category. And then the hallucinogen category, this is where you'll find things like LSD or mushrooms or any of those kind of psychogenic substances. And then the last is tobacco. And we classify tobacco on here because it can be problematic for some people. And one of the programs that we do offer is the STOP program to help people if they're wanting to stop smoking. So we classify tobacco on here as well. And we're going to move through a couple of the different categories and give you a little bit more information about some of the specifics of some of these. So Tanya is going to start off with alcohol.
Right, so just in explaining alcohol, so we know that it is what's called a central nervous system depressant. So it slows things down in your body, it relaxes you, it decreases your inhibitions and in low doses. In higher doses, it can make you appear intoxicated, it can impair your judgment, and you might have some issues with your coordination, with your walking, with your movements. And at very high doses, alcohol can actually cause coma and it can cause death. So we're going to flip the slide here and talk about what a standard drink is when it comes to alcohol. So on the screen, there's a couple different images, and one is of a 12-ounce, a fluid ounce can of beer, which is about that 375 ml regular can of beer. That's actually equal to that 5 ounce of wine at 12%, and also a shot, which is your 1.5 ounce of about 40% of alcohol. So when we talk about our standard drinks, that is, oh, let me go back for a sec. I'm not quite, there we go, thank you. When we're talking about our standard drinks, all of these drinks on this image are all equal. And so sometimes it makes it difficult if we're trying to see, how much have I drank? Sometimes it's hard to tell how much I've drank, and different things come into play, like if you're drinking punch, spiked punch at an event, or if you're having shooters, we don't know how much alcohol is actually in that shot. If you're sharing pictures with friends, so you can lose track of how much you're actually drinking. So one quick little tip to take home with you, I didn't have a solo cup with me, but I printed out one. So I'm sure you've probably seen one of these red solo cups at some point. So when you look at this cup, it actually gives you a little cheat sheet for keeping track of how many standard drinks you're drinking. So that bottom little lip on that cup, I don't know if you can see that, but that bottom little lip on that cup is actually your shot. So if you're trying to make a drink and you're trying to be aware of how many drinks you're drinking, you'd fill it up to that first line. The same with the second line as your wine. And then that bottom of the top rings, that's your beer. So it's just a nice little kind of cheat sheet to be able to keep in mind how much you're drinking. And just a couple quick myths that you might have heard about standard drinks. A lot of times people will say things like, you know, if I feel okay, I am okay. And Elizabeth had made mention to tolerance. So sometimes the more that we drink, the more that we need to feel that effect. So you might actually be drinking more than you think, but you feel okay, so you are okay. Things like a coffee or cold showers, we think that that's going to sober us up after we've had these standard drinks, or after we've had these drinks. But what that actually is doing is it's making you feel, it's giving you a shock, it's giving you a stimulant that is making you feel like you're okay, but there's still alcohol in your system. Yeah, so that's just a couple of myths that you may have heard. We're going to go to the next slide, which is just talking about blood alcohol concentration. So this is a pretty info-heavy graphic, but if you take a peek at the third one down, the 0.08 to 0.10. So 0.08 is your legal limit for alcohol if you are not in the graduated licensing system. So if you are supposed to be driving with 0 alcohol in your system. But if you're above that graduating licensing, that 0.08, that's when you become legally impaired. And that's when you might feel really good. You might feel tired. Your balance is probably off. Your speech and vision are a bit off. Your judgment is impaired, and that's what becomes really important when you're driving. And just to keep in mind as well that a legally impaired charge does include other substances as well, not just alcohol. But this chart is just happening to show you the alcohol. So hopefully you can go back and take a look at that later, just to see kind of as your blood alcohol concentration goes up, you know, you become drunk, you become dazed and confused, and that can result, as I mentioned, in coma or in death. Okay. The next slide is just to explain as well that when we talk about alcohol, there is such a thing as well as non-beverage alcohol. So that is items that have ethyl alcohol in them. They're not meant to be consumed because they have a lot of ethyl alcohol in them. It can be lethal, dangerous for your body. And that's things like Lysol, Listerine, and oftentimes these items are cheaper and they're easily accessible. So sometimes people can choose to use those because their other options aren't available to them. So just some health effects of alcohol use. So short term, we know that we can have impaired judgment when we're drinking. Sometimes people develop a red nose. They might feel a bit relaxed. And some people might even feel depressed when they're drinking short term. Long term, there are some consequences like liver disease, cirrhosis, cancer of the throat, mouth, esophagus and larynx, and different things like pancreatitis. So that stuff can come with long-term use of alcohol. And the next slide just talks about some signs of use. So if somebody is drinking, they may, as I mentioned, they might have some disinhibition, so they show less restraint. They might be a bit more impulsive. They might feel relaxed. Their judgment could be impaired. They might have slurred speech. Maybe they become super talkative because of that disinhibition. And intoxication is obvious in their body movements, so they look like they might have consumed alcohol. So when we talk about withdrawal, it's generally the opposite of what you experience when you're using. So with alcohol, it could be things like sweating, hand tremors, you might get the shakes, that's also called the DTs, or the delirium tremens, nausea or vomiting, seizures can occur with withdrawal, anxiety, insomnia, and even some auditory hallucinations, so hearing some things that are not actually there. And we're just going to skip back quickly just to impaired driving. So just to give just a little bit of information about, you know, when we're consuming alcohol, what some consequences of using vehicles. So all of these items here, the car through the railway equipment, those are all vehicles that can result in impaired charges if you are consuming alcohol. When we talk about e-bikes, bicycles, horse and buggies, can I get an impaired charge for any of those things? The answer is yes for an e-bike, because our criminal code discusses a motorized vehicle as a vehicle that you can be charged in, and an e-bike has a motor. It doesn't say how big the motor has to be. So whether it's a small motor or whether it's a big car motor, it's still a motor. So if you're riding an e-bike, you can receive an impaired charge, as well as things like boats, canoes, anything that you have care and control over and have to navigate, that can also result in an impaired charge as well. And a lot of times we get questions about, well, if I'm on my own property or if I'm on private property, can I be charged? The answer is actually yes, because the criminal code doesn't actually care where you are. If you are operating a vehicle, maybe if it's even a riding lawnmower and you're going to blow over, because of the criminal code, you can actually get an impaired charge. It's not as likely because the police aren't tending to watch people for this type of charge. But if they happen to drive by and see you driving erratically on a lawnmower, that can be a result. So just a little bit of information about that. The next slide is just asking you to consider and not to underestimate the risks of alcohol. So a lot of times, you've probably heard people joking about how they went out this weekend and they got really drunk and then they felt really bad the next day, and or even comparing hangovers to one another. A hangover actually is a withdrawal from a substance, and in some cases it can be really serious. So as I mentioned before, people can have seizures, and especially if you're taking other medications, like if you're taking a benzo, so any of those PAMs, clonazepam, Ativan, that can be, or any tranquilizers, that can be really dangerous. So just remembering that a hangover is actually that withdrawal, and that there can be some consequences that can be very serious from drinking alcohol. So I'm going to hand it over to Elizabeth to talk a little bit about some opioids.
Thanks, Dania. So the other big category of substances right now that a lot of people are using are opioids. Opioids are really good pain maskers, both physical pain as well as emotional pain. Opiates are drugs that are derived from the opium plant. And at one time, all opiates were plant-based. And over time, these drugs have started to be synthetic. Drugs that basically have been created to simulate the opium plant. However, they are different chemically. And so now we use the term opioid to classify all opiates, whether they are natural or whether they're synthetic. And so this class of drugs is very highly addictive, even if it's taken as prescribed. So oftentimes people will start using opiates because they were prescribed for something maybe like a broken arm or having their wisdom teeth out, and then from there they really like the feeling, this really extreme sense of well-being and feeling really well and happy. And so once they stop, the prescription stops and they have to stop taking them, they don't like the way that they now feel because that sense of well-being is gone. So then they will start using them, taking them not as prescribed or off the street. So some examples of opioids are things like codeine or fentanyl, often referred to as Fetty or F, morphine, Dilaudid, OxyContin, heroin, and street methadone. So how do opioids make you feel? Essentially, how it makes you feel really depends on many factors, including how much you use, how often, and how you're using. Are you injecting? Are you taking them orally? It often will include, how is your mood? What's going on with you? Your expectations of what the drug is going to feel like, as well as your environment. how old you are, and if you have any pre-existing medical conditions. So all of that will be taken into effect when you take an opioid, what kind of effect you're going to get back from it. But often what it does, like I said, it suppresses the sensation of pain, both physical pain and that emotional response to pain. So what it's going to do is it's going to produce feelings of euphoria. You might be feeling really drowsy or really relaxed. You're going to have difficulty concentrating on things. You'll have physical feelings of constricted pupils. And it's potentially going to make you feel constipated. It's going to slightly decrease your respiratory rate. It's going to decrease your heart rate. You might feel some nausea or some vomiting, feel like less like eating, and it can also increase your sweating because your heart rate and everything is decreased. So at low doses, it really does suppress the sensation. And at really high doses, it's really going to depress your heart rate a lot more. It's going to decrease your respiratory. And if you go too far and to the point where you're taking a lot more than you can tolerate, it's going to completely decrease your respiratory system to the point where you can stop breathing and your heart can stop. And that would be considered an overdose. So one of the things to warn people about is carfentanil or bootleg fentanyl. And this is something we're seeing a lot more on the streets. Carfentanil itself is an elephant tranquilizer. So it was never meant for human consumption. This has always been intended for animals. And so you look at the picture on the screen, the heroin bottle, there's a lot more of the substance in that bottle than the single grain of carfentanil in the other one. And so the single grain of carfentanil in that test tube is actually enough to cause an overdose in a person compared with the amount of heroin that it would potentially take to cause an overdose. So it comes from China. It often comes as a powder form, and then it often gets pressed into pills. And sometimes it's often mixed with other substances. So you might think that you're purchasing something like fentanyl or heroin or some other opiate that's not as potent, but it's got carfentanil in it. So there is always a risk of an overdose when you're talking about these synthetic opioids. So the pill forms often are colored, so they might be green, they might be blue, they might be light purple. So if you're ever seeing these substances and you really don't know what it is, please do make sure that you're very careful with them, because it's absolutely, you don't know that carfentanil is mixed into anything because it doesn't taste like anything. And it can, in one dose cause an overdose, leading to death. So with opiates and overdose, if you are using an opiate, you want to make sure that you have a Naloxone kit on hand or somebody nearby. And we're going to talk more about how to prevent an overdose later on in the session. Because with carfentanil, it has often taken many, many doses to be able to bring you out of an overdose from something like carfentanil. And Tana's going to take over for a little bit and do some stimulants.
Okay, so the stimulants we're going to talk about today are crack cocaine and crystal meth. Both crack and cocaine are created from the cocoa plant, but they have a different level of refinement, and that means just like removing impurities from them. So cocaine is generally that white powder. It's generally snorted, whereas crack is it's a rock, more of like a rock. It's a rock shape with a white cream tan or brown type of color. It's made from cocaine, but there's an addition of ammonia or baking soda, and that's generally smoked. So just a couple of visuals here so you can see what that would look like. And we do have a photo as well of a crack or meth pipe, which will be discussed later in kind of that harm reduction when it comes to substance use, but that is what that looks like. So some visible signs of crack or cocaine use and withdrawal. So when you're using, you might notice a crack or cocaine, somebody might have dilated or large pupils. They might, because it's a stimulant, it can increase your heart rate, increases your breathing, so it speeds things up. As a result, you might not feel very hungry, so you've got a decreased appetite. You've got lots of energy, so you're probably pretty talkative with that increased energy, and you might even become argumentative in your behavior. So the opposite of that use is that withdrawal. So you've got this crash, and from that you feel tired. Sometimes when people are coming off of crack or cocaine, they actually can't sleep. So they experience some insomnia. You haven't really eaten likely, so you might have that increased appetite. You might feel agitated because you're coming down, and you might have some vivid or unpleasant dreams that come along with that. So then kind of shifting over to the effects of crack or cocaine use. So short term, we know it increases your heart rate, it increases that breathing and your blood pressure. We mentioned that it can increase your agitation. You can experience abdominal pains, have seizures, or even nosebleeds, and that comes from snorting, the issues with snorting. Long term, because it's a stimulant, it's making your heart and your body work really hard. So heart attack and strokes are a possibility. So convulsions are a possibility, insomnia. Experiencing some psychosis can result in long-term use, and health impacts from poor nutrition and sleep. So if you're not, if you're up and you're not eating, your body's not being fueled properly, you're not getting the rest to kind of rejuvenate your body. So your overall health is impacted by that as well. So we're going to shift over to crystal meth. There's a lot of similarities because it's still in that classification of a stimulant. Methamphetamine or crystal meth, it appears like a rock or like a crystal. Sometimes it's called glass, crank, ice. Maybe you've heard it called Tina before. It has a few different names. It is made in illegal labs with lots of household chemicals, so that's very dangerous. It has lots of dangers related to its manufacturing. I don't know if you've heard about the dangers of that, but it's dangerous. People are doing it in their homes and using chemicals that are very dangerous to be mixing together. Crystal meth can be smoked, snorted, injected, or swallowed. And it has a long-lasting effect, and which is part of the draw for some people when they choose crystal meth, because it can last up to about 12 hours, and at its cost, it's a fairly cheap substance, so it has a long-lasting impact for not a lot of the financial impact that other substances have. So we're going to shift over to just talking about what the signs are. So if you see someone that might be using crystal meth, they might appear talkative. They might have increased energy. They might have those dilated pupils again, so those enlarged pupils that increase heart rate and breathing, irritability, and they're going to likely be a lot more alert. Generally, when you're using crystal meth, you're not sleeping. So when you withdraw, you're going to feel really tired. People can be up for days. And when you come down off of crystal meth, it feels really terrible. So you want to generally use again so that you can relieve those withdrawal symptoms because you're feeling irritable. You might be feeling depressed, confused. A lot of times people will be itchy, so they'll itch their skin, which might result in things like sores on your face or your arms or your body. And when you're using, you're just similar to crack and cocaine, you're likely not eating a whole lot. So when you're withdrawing, you might feel hungry because you haven't been eating. And so some of those things will kind of focus now on those short-term and long-term effects, because these signs of use impact our physical health and our mental health. So short-term, I mentioned you might have that decreased appetite, increased respiration, things are going pretty quick. Tremors, convulsions, anxiety, and paranoia. So a lot of times people, when they're using crystal meth, they've been up for days, they haven't been taking care of themselves. So they have a lot of anxiety, paranoia, seeing things that aren't there, and really believing that things are occurring in their world that aren't actually there. So that is the short-term impact. Long-term I mentioned was lesions. So if you're using and you're itching, you'll end up with scabs through all over your body. We talked about health impacts from poor nutrition and lack of sleep. So a lot of times people have issues with their teeth, and that's often referred to as meth mouth. And that comes from people grind their teeth a lot. If you're not drinking water and keeping yourself hydrated, your body, your mouth doesn't have that saliva protecting your teeth, so it dries them out. And because you're up for days and you're not thinking about your oral hygiene, you're not taking care of your teeth as well. So that's kind of some of those health impacts for your mouth and your teeth. Insomnia, so you can be up for long amounts of time. Psychosis, as I mentioned before, and some irreversible brain damage. So crystal meth is one of those substances that when there is brain damage that occurs, it may be irreversible down the road. Okay, so that is crystal meth. We're going to move on to cannabis in its own little section here. So there's just some images here of what cannabis looks like, what different forms of cannabis looks like. It comes in different strains, it comes in different types. So we're not going to go into all those details about, the oils and the edibles and the different strains. Cannabis can be used in multiple different ways as well. There's like 20 something different ways that you can use cannabis. So that's a whole presentation on its own. But so we're going to talk about cannabis. So some of those signs of cannabis use can be those red eyes, misjudged time, decreased reflexes, so you're not moving as quickly as you normally would. You might feel pretty chill or relaxed, talkative, and experiencing those munchies where you're just hungry and you just want to eat. And so, as with use, there's the withdrawals. So when you're coming off of cannabis use, you might feel a bit irritable. You might have some sleeplessness. You might feel anxious. Some people may also feel a bit more of aggression. So the health impacts of cannabis, the short and long-term effects. So those short-term effects are things like your heart is beating a bit faster. You might feel anxious or panicked while using, especially if you have some other mental health, underlying mental health conditions interacting with the cannabis. Bronchitis from smoking, loss of your coordination, and impaired short-term memory and concentration. So you might have issues staying present or remembering things that have happened or information that you would like to recall just isn't there. So long-term, depending on how you're using cannabis, chronic cough and respiratory problems if you're smoking, same with the risk of cancer. It can decrease your immune system. You can have some depression and anxiety as a long-term impact, having some difficulty learning, and impacts to your brain development. So we do know as adolescents, our brains are growing and they're creating these new pathways. And so when we're using cannabis, oftentimes though that development is interrupted. So that can change actually the shape of our brain, the density of our brain, and that can impact how we learn things, how quickly we learn things, how we retain information, how we keep information in our brains, how we store information in our brains. And it can also increase some mental health concerns. So it can bring out some of those mental health concerns that are there as well. So just things to consider if considering or using cannabis. So I'm going to pass it back to Elizabeth again to talk about some harm reduction.
So we wanted to really build in harm reduction because at Addiction Services, we work from a harm reduction philosophy. So harm reduction is defined as a policy or program directed towards decreasing the adverse health, social, economic consequences of substance use without requiring abstinence. So what that means is if you are looking for treatment, none of the counselors are going to require that you are using substances, that you're using them safely, and that it's not causing any other adverse health effects or problematic effects in your life. Now, harm reduction doesn't mean that abstinence is off the table. So the harm reduction lens is inclusive of abstinence, but not necessarily. At the end goal might be abstinence down the road, and to get there, we're going to work on a moderation or a harm reduction plan to taper down to at some point becoming abstinent from the substance. We do basically start where the person is. So we work with our clients to come up with a goal, their immediate focus, what are their most pressing needs, what are the goals that they need to work on in that moment. And it's really based on developing some incremental gains. And the more positive movement that you see built into your life, the more people are saying, you know, hey, I don't really need the substances there anymore. I can cope without them. So we work on developing additional coping strategies to the point where someone's like, you know what, I don't need this anymore. I don't need to use the crystal. I don't need to, you know, use any more cannabis. I can be able to cope with everything that I'm going through, you know, without it, and I can become abstinent, and it's no longer problematic in my life. So we really do recognize that people benefit from a variety of different approaches, and we work with our clients to make sure that they're the ones choosing their, you know, their goals and their approach, and we want to empower them with their choices. So what harm reduction is basically is we're just going to focus on changing some of the ways that we do things to reduce the harms. So sometimes that means we need to maybe get some harm reduction supplies. So Tanya mentioned the crack or the meth pipe. So making sure that you're using clean, unused equipment. You know, if you're using the same equipment over and over again, there's a risk of developing an infectious disease or, you know, increasing harms, you know, like cancers or, you know, taking other things in. There's things like endocarditis that you can develop, which is damaging the sac surrounding your heart by using a needle that's been used by somebody else, or, you know, different ways to inject. So we always encourage people to make sure that they're getting unused equipment, you know, unused needles, unused crack pipes, not sharing things like cookers or water pipes or things like that, making sure you have your own supplies. And so some of the places in Elgin County and Oxford County that you can get harm reduction supplies, you know, both from the public health units, any health agency, so Central Community Health Center, West Elgin Community Health Center, Oxford Addiction Treatment Centers, both in Ingersoll and Tillsonburg, and then the mobile outreach that works both in Elgin County and Oxford County are working on getting themselves back out there on the streets. Right now they are doing it by calls or texts. So you call them and they will send equipment out to you. But they're working really hard to get themselves back out there so that they can bring things to people as well. So one of the things with harm reduction is we are working really hard to make sure that people are not overdosing. So overdose really is when you take too much of a substance that your body cannot tolerate, and it develops those really intense symptoms, things like Tanya said about coma, death, basically slows all your respiratory systems down. And what we really want, you know, to do is prevent that. So the risk of an overdose really does increase once you've lost your tolerance. So if you've stopped using for a period because you've been an inpatient at a hospital, you've gone to treatment, if you've been in jail, or you've had any period of abstinence, your risk of an overdose increases at that point. So the only way to really prevent an overdose is to be abstinent. And if you've had a period of abstinence, it's easier to keep that abstinence going than after you've lapsed or relapsed. But if you are going to go back to using, you want to make sure that you don't use alone. Make sure that you are using with somebody else there so that if something happens, you have someone that can call 911 who can administer naloxone or start CPR. Use small amounts. Do not go back to the same amount that you were using prior to your period of abstinence, because your tolerance is different. So make sure you start with a small amount and then increase if you need to. Again, make sure that you're using unused equipment, so making sure that you've got your own, so that you know what you're putting in it and not using it something that already has another substance in it. Again, make sure that you have your naloxone kit, and sometimes you might need multiple. So if you are using opiates, make sure that you have several of these on hand, or you've got somebody else that has some too. So that, because some of the carfentanil and synthetic fentanyls that are on the street, it's taking multiple kits to bring somebody back around. And then if you are really worried about what you're using, you can always visit CarePoint, which is the Consumption and Treatment Services in London. And it is a site where you can use safely, that is monitored by medical staff. So there is somebody there to make sure that you are using safely and that you're not overdosing. And if you are, they are medically trained to be able to help you with that. Call 911 and get you to the hospital. So looking at naloxone itself, naloxone is a essentially antidote for an opiate. It will reverse the symptoms of an opioid overdose. Doesn't work on any other substance, but we do know that opioids like fentanyl and carfentanil are being mixed into other substances like crystal, even cannabis. So if you aren't using opioids, there's still a risk of an opioid overdose with other substances as well. So it is good to have this on hand. So with that opioid overdose, your respiratory system shuts down, your heart rate shuts down, you stop breathing. If you see any signs of an overdose, that you can use one of these two kits. So there's an injectable kit and there's a nasal spray kit. And basically what you want to do is you want to open it up. It will have 2 doses in it. The nasal spray is the most common. So what you do is you essentially will open up one of the nasal sprays. You will basically put the nasal spray up the nose of the person who's overdosing. You will press the plunger and you're going to spray it into their nose. And then you're going to give them CPR and you're going to do chest compressions. And you want to do that and follow the instructions. If the person does not revive, you can give them the second dose. If you are using this, please make sure you are calling 911, because this is only temporary, and you want to make sure that the person is going to get medical intervention and not re-overdose. So if they do come to, there is a possibility of them overdosing again, depending on how much they've used. So you always want to make sure that 911 is on its way. Along the harm reduction line is what we call addiction medicine therapy. And so addiction medicine therapy is essentially a replacement or a way to take medication to avoid using the substance. Addiction medicine therapy is becoming more and more, so there's more substances that we are now finding medication that you can take that will help prevent the cravings or the effects of withdrawal, or be able to help somebody avoid having to use a substance. So with opioid replacement therapy, you're looking at things like methadone, which is an opioid itself. It's an oral drink and it's usually taken daily. There is Suboxone, which is an oral Suboxone pill taken daily. Other forms are Sublocade, which is an injectable form of Suboxone that lasts up to 1 month. So it's not something that has to be taken daily, but it can be taken every month, and that way you don't have some of the same negative things like having to go to pick up your pill every day, having to check in with your doctor on a weekly basis. You can go once a month and have that injection. And then there's Probufene, which is a Suboxone implant, and it's 4 rods that are actually implanted in the upper arm, and these last up to 6 months. So you would only have to have them implanted every 6 months. On the alcohol side of things, there are a number of different medications that you can use. Naloxone is the one that is most recommended. It's an oral medication and you take it daily, and essentially it blocks the pleasurable effects of alcohol so that you feel like you don't even want it anymore. And when you do drink, it doesn't feel the same, so then it's like, why am I drinking anyways? And the more you take those, and the more you then work with a counselor on all of those other things underneath the iceberg, the more you realize you don't even need the substances anymore, and you don't want them, and you're able to cope with things on your own. So Tanya's going to talk about how to support someone who's using substances.
Okay, so when we talk about people making choices to make change, we take a peek at this quote here. So most people who need to make a change are ambivalent about doing so. That means that they see both reasons to change and reasons not to change. And so that's a really normal thing to experience. And even just thinking about your own experiences, whether it's related to addiction or not. Any type of behavior change. Maybe it is eating healthier or exercising or doing schoolwork throughout the week. You always have reasons that, yeah, I want to do that. So yeah, I want to feel better when I exercise. Maybe I want to lose some weight. Maybe I want some more energy. These are reasons for me to make change. And then we have some thoughts, well, okay, I'm going to maybe have to get a gym membership. That's going to cost money. I'm going to have to maybe wake up early in the morning to work out. So those are the reasons that maybe we don't want to make a change. So that's a really natural experience. And it's really important to recognize both of those different feelings about making change and working with that. So as we talk about that, there is something called the stages of change. And as I said before, it's about any different change, whether it's substance use or not. People go through these different stages. And now it's in this pretty little graph that goes from 1 to 5. But knowing that someone that's going through stages of change can bump back and forth to various different stages. So I'm just going to quickly go through them just so that you have an idea of what they are. The first is pre-contemplation. That's when someone thinks, I don't have an issue at all, no problem. Contemplation is when someone starts to say, maybe I've got an issue, maybe this is a problem. Preparation is when they say, okay, yep, I know this is a problem. What am I going to do about it? I need some help. Action is, when they're making some changes. They're coming into counseling. Maybe they're taking some of this addiction medicine. Maybe they're making changes in their friends, things like that. And then there's maintenance, so that you've made some changes and you're maintaining them. You're keeping those changes going. So it's important to know, as I said, people can bounce around through these stages of change. And really, when someone's in contemplation is the best time to help people to really prepare for that change. Because if they're considering that they don't have an issue, then no change is going to occur. So just being aware of where people are at when you're wanting to support them. We can't make people change, but we need to listen for where they're at to be able to support them into that next stage of possible change. Okay. Back to Elizabeth to talk about the treatment continuum very briefly.
So when people think about treatment for addictions and substance use, usually the first thing they think of is residential treatment, that they have to go away and they're going to be away from their home and their family and their friends and all of their life. But really, that's only one aspect of the treatment continuum. At Addiction Services at Thames Valley, we actually do what's considered community treatment. That's the one with the star. So what community treatment is you live at home, you continue to work or go to school or, see all your friends and have your life, but you come and you see a counselor on a regular basis, and we work together to make changes and support you towards your goals. Other areas on this continuum are things like detox. So community withdrawal management, whether it's going away for a few days just to fully detox from a substance, or whether it's working with our nurses to work on a withdrawal plan to safely withdraw from whatever substance. But just keep in mind, there are lots of different ways to get treatment rather than just having to think, I've got to go away.
Okay, so our programming at Addiction Services, there's lots of information about our various different programs. You can visit our website, which will be at the end of the slide deck as well, but it is adstv.on.ca. And when you go on there, if you check under the link, help for myself or help for someone else, these little tiles come up on our website and they explain all of our various programs. So I don't have the time to go through all of them with you today, but just knowing that we have different programs that are substance specific, like the opiate program. We have a program that looks at problem gambling, gaming, internet use, and other types of behavioral addictions. We have an addiction supportive housing program that provides housing along with counseling at the same time to help people build stability in their lives. We have the French mental health and addiction system navigation. So if somebody wants or needs or prefers support in French, we can help them with that. There's the Back on Track program, and that is for people that have received impaired charges. They have to complete this program, and it's located in our London office, and there's a fee associated with that. But just some of those examples, feel free to check out the website, click on those tiles to get some more information about what they are. Or at the end, there'll also be Elizabeth's and my information. If you have any questions about the programs, give us a call and we'll be happy to explain each and every one to you.
So in Elgin County, we actually are located in 3 different places. So we've got our office in St. Thomas on Monument Street. I work out of the office in Elmer, and I'm located in the East Elgin Family Health Team building. And we also have a counselor that works in West Lorne at the Community Health Center there as well.
In Oxford, I'm located at the Oxford County Community Health Center on Metcalfe. We also provide services for people in Ingersoll and Tillsonburg. We don't have office space there, but we do graciously accept spaces from partners in the area and at the nurse practitioner-led clinic or at the library or at the Livingston Center in Tillsonburg. We try to meet people where they're at in the communities where they live.
And so if you want to get connected or you want to pass this information on to someone who you think could benefit from our supports, right now during COVID, we are doing our services virtually, but we do have a plan in place, provided everything continues the way it is, to be able to get back to doing in-person services. But the easiest way to connect is just through one of our phone lines, and our phones are answered by our staff Monday to Friday from 10 to 3 at our main number there on the screen. And then we have different extensions depending on if you're a current client, if you're a family member looking for just some support with regards to a family member or close friends, substance use, if you're looking for withdrawal support and French language services. So we very much appreciate and thank you for having us be a part of your Hub's Wellness series to talk about addiction, substance use, and wellness. And if you need support or know someone who does, we are always here to help in any way that we can. And if anybody has any questions, we can essentially, I think, stop the recording at this point and take some questions.